Greetings, dear colleagues. I would like to say hello to the managers of the symposium and to thank you for granting me the opportunity to share with you our limited experience and to be able to hear interesting and very important recommendation with the help of this forum. Let me present to you a short video before I start my presentation.
Georgia, eastern gate of European civilization, the heart of the Caucasus and the crossroad of the world cultures. A small country surrounded by the Caucasian Mountains, which has served the purpose of the connecting bridge between Europe and Asia for several thousands of years. One among the homes of the first inhabitants of the earth, cradle of winemaking, with 3 types of unique alphabets protected between literary traditions and intangible monuments of UNESCO. This is Georgia. Aversi Clinic. In 2013, Aversi Clinic was awarded with an International Quality Certificate ISO by German quality controlling organizations TÜV-SÜD. Aversi Clinic Lab is the first in Georgia to pass the accreditation for medical lab with ISO quality standard. Aversi Clinic is a leading multi-profile medical institution in Georgia with top quality equipment and a vast amount of branches. In 2015, for the first time in the Transcaucasian region, endoscopic transaxillary thyroidectomy with BABA approach was performed and incorporated into Aversi Clinic practice. For the first time in Transcaucasian region, thyroid gland was removed through the oral cavity in Aversi Clinic. Our doctors, together with the colleagues from Seoul National University Hospital, performed transoral endoscopic thyroidectomy. Aversi Clinic has been collaborating with Seoul National University Hospital for years. This cooperation led to the introduction of the endoscopic endocrine surgeries in Georgia and its implementation in the daily practice. Medicine unites us all. Thank you.
Okay.
Hello, Edisher.
First Baba in Caucasus region was performed with the support for our Korean colleagues from Seoul National University Hospital, Professor Kyun Lee and Professor Ra Young Song in October 2015. And this fact is the basement for developing oncoplastic surgery in the region, because this patient was operated for thyroid adenoma. First TATVA with central lymph node dissection in Eastern Europe and post-Soviet states was performed in January 2018 with the support of our Korean colleagues, Professor Jin-Wook Lee of Inha University Hospital, and this particular fact let us expand the volume of performed operations, and we were able to operate patients not only with thyroid adenoma but with thyroid cancer. It was possible to sign the memorandum between Aversi Clinic and Inha University Hospital with the great help of Professor Jin-Wook Lee. Total of 41 operations have been performed in the Aversi Clinic during this while, 32 Baba and 9 TATVA. Total thyroidectomy with central lymph node dissection was performed with 8 patients. Practically all of the patients were confirmed to be treated according to the TG and ultrasound follow-up. We had one case of transient mental nerve injury. Treatment was performed with group B vitamins, anticholinesterase drugs, and physiotherapy procedure. The main obstacles, in our opinion, for being slow in implementing and popularizing this safe and effective method are conservative approach of the colleagues, elder colleagues, patients being skeptical about this particular method. Operated patients usually don't talk openly about the use method. And one more problem I'd like to highlight here is the lack of training centers. I want to thank once again our colleagues from Seoul National University Hospital and Inha University Hospital for the great support. I want to thank the managers of the ISOPES, and I'd like to express special thanks to the president of ISOPES, Professor Jae-sung Kim.